Well, actually, that's been a question for quite some time. They're not really sure. They have some theories and they try to do some studies, and some people feel as if it is due to the fact that practitioners don't see as much risk in women as they do in men, and many times women don't perceive themselves as being at risk, as much risk as men do. Their symptoms are different and their symptoms are vague, so many times they don't perceive them as being anything heart related. We think of men having heart attacks and we think of their symptoms and their clutching their chest and having extreme chest pain and having all the symptoms of the sweating and shortness of breath. We think of that as what a heart attack is. But many women we're finding that are coming in and have had a heart attack, had a silent heart attack, and didn't even know it. Yes, there are many people that have had silent heart attacks, and we know this when they've come in and had testing later, or they've had symptoms that indicate that they've had some heart damage to their muscle, and they've had a heart attack in the past and did not know. And we think of the classic heart attack as like we discussed earlier, the sharp, stabbing, clutching pain, but we can have silent heart attacks that don't present any of these symptoms, but over a long term damage the heart muscle. The chest pressure, the pain, the associated symptoms with the shortness of breath, that is the majority of the symptoms. However, more women have symptoms that are not to that extent. They may have just a little bit of shortness of breath. They may have discomfort in their right arm, not their left arm. They may have just extreme fatigue with no other symptoms. They may have nausea. They may have some discomfort in their jaw, in their neck, in their back. Some women present with only back pain and no other symptoms whatsoever. Well, for one, smoking. Smoking is one of our number one risk factors. It's one of the biggest risk factors for anyone that smokes, but women that smoke tend to have more heart disease than men. And if you are a smoker, you have a 25% more chance of having heart disease. So that is one of your number one risk factors that you are able to change. Being obese, unhealthy eating a diet high in saturated fat, high in sodium, inactivity. The American Heart Association recommends that you have 150 minutes of moderate aerobic activity a week, and that is like 30 minutes a day, 5 days a week. That's what we encourage. Family history, you need to know your family history. If you've had family history of a mother or father or siblings that have had heart disease, that's also a risk factor. Well, your best course of prevention is to start off early. There's very few studies of women in their 20s through their 40s of heart disease. At that time, there's generally not a lot of heart disease detected, but that's when you need to start with prevention. At that point, if you're a smoker, quit. If you're not a smoker, don't ever start. Exercise. Start exercising right away. Just 5 days of walking. It can be walking, it can be biking, jogging, swimming, something that's cardiovascular. Know your risk factors for one, know your family history. Make sure that your blood pressure is under control. Having high blood pressure is another major risk factor, and making sure that you monitor your blood pressure, have it checked by your family physician, make sure that it's under control is another way to help prevent further heart disease. If you have any of these symptoms, report them to your family practitioner. Definitely your immediate family members, definitely your mother and your father, and if you have any siblings. And then on top of that, yes, from there go to your grandparents and to mostly your grandparents, but the mother and father especially. If you have a mother or father that had early heart disease, then that's a risk factor. I think somewhat, yes, especially when we see young women and they've had heart attacks and they're just completely surprised. But for some women, I find that they feel almost a sense of relief to know what is wrong. They've had these odd symptoms. They've been working, raising their children. they've not wanted to mention it to anybody because they weren't sure what it is, but they know what it is, and especially if they've caught it early enough to be able to manage it and take care of their heart disease without having any permanent damage. Well, our smoking population is quite high, and that is one of our number one risk factors and one of the hardest things to get people to change. And I think, though, at this point that we're seeing a lot of young smokers or even middle-aged still don't see, they don't see the correlation, and they don't see the connection between the heart disease and other vascular disease and smoking. So I still think that it's a pretty significant issue in the area. Diabetes is one of the number one risk factors in addition to smoking and high blood pressure and high cholesterol. Diabetes makes you at much greater risk to have heart disease. So if you are diabetic, keep your diabetes under control. It causes a lot of small vessel problems, microvascular we call it. So if you're diabetic, and especially if you're not controlled, that puts you at much greater risk to have heart-related complications. Stress can play a role in heart disease in a couple ways. One, if you're depressed and you don't have that treated, depression can cause you not to have a healthy lifestyle. You don't want to be active, you don't want to eat correctly or eat healthy, so stress and depression both can play a role. So if you are depressed, please see your family practitioner and have that addressed, so that way you are able to eat a healthy lifestyle and exercise. Stress itself can play a role too in heart disease. Stress hormones are released, and these stress hormones cause our blood pressure to raise. They cause our vessels to constrict. This is our body's way of reacting to stress, and this over time can cause cardiovascular disease. It can cause our arteries to be stiff, and it makes it easier for plaque to form in our arteries. So yes, stress can play a big role in heart disease.